Everyone, this is Danish Rafiq. In this video, we will talk about new orders regarding containment of COVID-19 which shall be implemented from 1st of September 2021. And in this video, we will also talk about the reopening of higher educational institutions in the Union Territory of Jammu and Kashmir. A detailed review of the current COVID-19 situation in Jammu and Kashmir was held by Chief Secretary Jammu and Kashmir with the Additional Chief Secretary Finance, ACS Health and Medical Education Principal Secretary, Home, Divisional Commissioners, Deputy Commissioners, Superintendents of Police and other officers of Jammu and Kashmir on 27th of August 2021. The above review was conducted to assess overall situation pertaining to spread of COVID-19 in Jammu and Kashmir, particularly focusing on the following parameters: total weekly new cases, total positivity rate, bed occupancy, case fatality rate, vaccination coverage of targeted population, extent of compliance to COVID-19, appropriate behavior. It was observed that there is need to continue with the existing COVID-19 containment measures in all districts in view of uneven trend observed in daily COVID cases. The State Executive Committee reiterates that following measures shall continue to remain in force. The maximum number of the people permitted to attend any indoor or outdoor gathering shall be strictly restricted to 25. All district magistrates and superintendents of police shall ensure compliance. There shall be no weekend curfew in any district of Jammu and Kashmir. All schools, including coaching centers, shall continue to remain closed for on-site, in-person teaching till further orders. However, the higher educational institutions can be permitted to commence with limited in-person teaching subject to 100% vaccination of staff and students and specific permission of concerned deputy commissioners. Such institutions can organize special vaccination camps in consultation with district administration. Other educational institutions can allow attendance of vaccinated staff for administrative purposes. Night curfew shall continue to remain in force in all districts from 8 p.m. to 7 a.m. All district commissioners shall intensify testing by making optimum use of available RT-PCR and RAT capacity. There shall be no drop in testing levels. The deputy commissioners shall also focus on the positivity rates of the medical blocks under their jurisdictions. Intensified measures related to COVID-19 management and restriction of activities shall be undertaken in these blocks. There shall be renewed focus on panchayat level mapping of cases and effective micro-containment zones shall be constituted wherever unusual spike of cases is noticed. DC shall keep acute track of positive rates in blocks. Consider implementing stricter control measures in closed cluster spaces like public, private offices, community halls, malls, bazaars, etc. in case weekly positive rate goes beyond 4% in these blocks. The 3T protocol of testing, tracking and treatment. Besides vaccination needs to be strengthened in these blocks. The proportion of RT-PCR tests in the total mix should be scaled up on the best effort basis to 70% or more, excluding travelers. Intensive vaccination drive shall be taken up in all districts to ensure timely administration of second dose besides maximizing first dose to vulnerable groups. Positive cases so detected as a result of intensive tests need to be isolated, quarantined at the earliest, and their contacts shall also be traced and similarly isolated, quarantined and tested if needed. Immediate isolation and treatment of COVID-19 patients shall be ensured in treatment facilities, hospitals, homes, etc. The district magistrate shall strictly ensure that there is full compliance to COVID-19 appropriate behavior and defaulters are firmly dealt under relevant sections of Disaster Management Act and Indian Penal Code. The district magistrate shall constitute joint teams of police and executive magistrates for intensifying enforcement of COVID-19 appropriate behavior. The joint team shall submit daily reports regarding activities carried out by them and their assessment of compliance level. DCs will intensify the campaigns for ensuring COVID-19 appropriate behavior. Dedicated IEC including public announcements through mobile vehicles must be undertaken at every point applied to UT of Jammu and Kashmir and Lakhanpur, mandatory testing for COVID-19 can be dispensed with for those who have received both dosages of vaccines, provided that a reliable and verifiable system can be put in place in consultation with the medical team. Entry into parks can be permitted to vaccinated persons with due verification. I think this is enough from my side. So with this, I would like to conclude here.